My name's Dr. Kenneth Burson. I'm a dentist here at the Denver Dentist. I've been practicing in this location for 8 years and a little bit over 15 years in my career. So, a patient often seeks a new patient appointment first. We get to talk about their desired wants, needs, what that outcome looks like for them. And then with digital dentistry, it's amazing. We can get an AI generated video of what the patient's looking for, how I best can conceptualize it, convey it into AI, and then we can see not only pictures, but video of that patient in their new smile before we've ever even touched the tooth. We can then, with 3D printing, we can print that smile and have a patient snap that on over their teeth before we've drilled anything so they can actually see what it would look like in their mouth. Once the patient's ready, then there's a sequence of waxing everything up, getting that wax up into the office, confirming it's the vision that the patient and I have identified as what our goal outcome is. And so considers a map of sorts of how we're going to progress through this smile makeover. Patient then comes in, we prepare all the teeth, and we try and be as minimally invasive as possible. That's very important to help keep some of the liveliness of the tooth and get a very superior aesthetic result. And so that appointment, a patient goes into temporaries and wears those temporaries that are also 3D printed and spectacular in compared to the handmade temporaries of old. And that patient may be in those for 1 to 3 weeks as we test out the new shape and size and form of the new teeth in the smile makeover. And then once we're ready, the lab has fabricated crowns or veneers that's going to achieve our smile makeover. They're sent back to the office, we try them in, and as long as it brings two thumbs up and a smile or tear of happiness, we cement those on that same day, and the patient's off living a new life with a new set of pearly whited teeth and a newfound confidence. We oftentimes want to use what we already have, and just with subtle enhancements, maybe recontouring shape, closing spaces, lightening the shade of the teeth can enhance, but we don't want to take off too much tooth structure. So the recipe to the success is being very thoughtful and thorough in the workup of this smile makeover, in communication with the laboratory technician about what we want to achieve so that we can be minimally invasive and reduce as minimal amount of tooth structure as possible, which then would allow us to only simply enhance one's own teeth. There's definitely cases where, due to deep staining, chipping, and cavities, we have to be less conservative, but those come with their own reasons. If you have a patient that doesn't like the shape, subtle spacing, or slight coloration differences, that's where these minimally invasive approaches are spectacular in what they offer, and what actually the resulted outcome looks like. It's very common that once patients get their final smile makeover veneers or crowns on their teeth, they can't stop smiling and often get tearful because it really does start a whole new level of confidence for these patients. It's very individualized. So that comes patient to patient. Sometimes patients simply need whitening. Other patients we're doing whitening and veneers and Botox and lip fillers. Some patients are getting gum contouring. So it's individualized. The important thing is that the patient, that their vision of what they're looking for can be understood by their dentist, and that the dentist can help guide them as the best approach possible. Sometimes patients come in thinking, oh, just to achieve this, I'll just need a little bit of a filling. And they find out there's more to it, to expose proper proportions of teeth and to really be able to achieve the best outcome. There's oftentimes more than meets the eye is what all goes into it, and it's a wide variety. But rest assured, whatever that recipe is, we're going to be able to identify that for you and be able to show you what that looks like before you committed financially, or more importantly, committed to any sort of irreversible procedures. First, we have to find out what the goals are of the patient. The facial features will come in the design phase, and that's really going to be me in the lab communicating. If this patient has a rounder face, triangular face, rectangular face, that comes where we find a way to mesh the facial aspect shape with the tooth shape contour. But to get there, we have to be able to find out what the patient's desired goals are. And that comes with really good intentional conversation and a dentist that's willing to listen and really repeat back to the patient until they know that they're on the same page for exactly what the desired outcome is. I would say that the confidence changes are skyrocket confidence. I think of this one gal that had smaller lateral incisors. The second teeth from the center over, hers were just always smaller. She'd gone through this long orthodontic straightening process to get proper shapes. And when she went into her final veneers, it was tears of joy, hugs. She sent the office a whole care package saying thank you. Now that patient, a year after, is engaged to get married, has quit and applied for the job of her dreams and got it and is thriving. And so I think it unlocks an unknown confidence for patients that allows them to try and go for what may be their dreams that they may have been holding back, not because they didn't have confidence or didn't like their smile, but there's a newfound level of confidence oftentimes in these smile makeovers. If someone in Denver is interested in improving their smile while keeping their natural teeth healthy, they easily get started by giving us a call, starting a conversation. Patients oftentimes don't know entirely what's available for their unique situation until they've been able to sit down with us, until we've been able to take proper photography, map out realistic options for their desired goals, budget. There's obviously porcelain veneers, which are beautiful but can be expensive. There's now 3D printed veneers or injectable composite veneers that are half the cost, that sometimes is a lower bar for exactly what they want to get them started down that smile makeover journey. So it's hard for you to know what's available for you until you make an appointment and have a real true authentic conversation about what you want, and our job's to tell you how to get